This is critical thinking in urinary anatomy, and here are the questions. The first one, second one, and here's the third one. Now let's look at the first one, which tells you that one of the functions of the kidney is to produce erythropoietin, which is a hormone, and which is needed for erythropoiesis, which is formation of red blood cells. So what would be the effect in a person with kidney damage? Now, if you look, there's a pattern here where I want you to know what is the result if something is missing. So you must think critically in this aspect. So now, if erythropoietin is missing, naturally erythropoiesis or red blood cell formation cannot occur properly. So what would it lead to? And let's look at the choices. The first choice is anemia, which is the correct answer, because when you have less than normal red blood cells or less than normal hemoglobin, that's called anemia. Now, without erythropoietin, obviously the number of red blood cells formed will be less, so hence it will cause anemia. Let's look at the other choices. The second is bleeding disorders. Now, this is not true, because bleeding disorders will occur only when either platelet count is low due to maybe lack of thrombopoietin, which is formed by the liver, so low platelet count, or if there is a lack of clotting factors. So any of these, if there is a lack, that will cause bleeding disorders, but low red blood cell count will not cause bleeding disorders. Obviously, it will not lead to transfusion reactions, and it will also not lead to decrease in blood supply to all organs. Blood supply is based on the arterial and venous drainage of an organ. Low red blood cell count is not going to affect the blood supply, in other words, the number of arteries or veins which supply an organ. So hence the answer is anemia. Now let's look at the second question, which says, what is the need for the glomerulus to have an arteriole feeding it as well as have one exiting from it? And now if you look at the Bowman's capsule, so if I was to draw the Bowman's capsule here, and then this comes down and this becomes the proximal convoluted tubule. Now in this Bowman's capsule, you have the glomerulus, which is formed by the afferent arteriole. So this is the afferent arteriole, which breaks up into capillaries, and then you have a narrower efferent arteriole which comes out. So this is efferent arteriole. So it asks, why do you have this? Both are arterioles. Usually when an artery or arteriole breaks up into capillaries, you have a vein coming out. So let's look at the choices, and let's go from below upwards. So the first choice is to allow the hormones produced by the kidneys to enter the bloodstream. And we already looked at one of the hormones, which was erythropoietin. So there was erythropoietin is one hormone. The other hormone which is produced by the kidney is renin. We also have angiotensin, which is activated. So these are some hormones. But the reason is not to allow the hormones to enter the bloodstream, because that would mean that every endocrine gland which produces hormones would have arterioles ending in capillaries and further getting arterioles, and exit arteriole also, but that's not the case. So this is not true, because hormones produced by the kidney can enter the bloodstream normally. They will just pass out into the extracellular tissue and then into the blood vessel. So they don't have to have two sets of arterioles. The third choice here, which is the statement here which says no veins in the kidneys, that also we know is false, because there are veins in the kidneys. So therefore this is not the right answer. The kidneys have a rich vascular supply. They do have a rich vascular supply, but that's not the reason why you need the glomerulus to have two arterioles, one entering and one exiting it. And let's look at the first choice, which says to allow for filtration pressure. Now this is true, because as blood flows through the afferent arteriole, which is of a larger diameter, and it gets into the capillaries, it takes some time to get out through the efferent arteriole, which is of a smaller diameter. So what happens is there's a pressure buildup here, and that is known as filtration pressure. And it's because of this filtration pressure buildup here in these capillaries, this is more than the pressure in the glomerular capsule, and that allows filtration to occur. So plasma gets filtered, large molecules stay in the bloodstream and exit, And then that filtrate which passes out gets into the nephron and then continues its journey, and you'll read more about that in physiology. So you need to have a filtration pressure in order for filtrate to form, and from this filtrate finally urine is formed. So that's the answer to this question, why you have two arterioles at either end and you also have a diameter difference in them. If you had a vein coming out at this end, the blood flow will be extremely sluggish. You need to maintain pressure at both ends and have a pressure in the middle, which is the filtration pressure. So that's why you have an arteriole feeding it and one exiting from it. Let's look at the last question, which says the ureter has a very thick muscle wall which allows urine to be formed here. Now that's not true. Urine is formed in the kidney. It is only transported in the ureter. Filtration is also not true, because you know that filtration occurs in the glomerulus. The ureter only transports. It's only a transport and transport structure, and the urinary bladder is a storage structure. So filtration doesn't occur here. There is no absorption either of important substances in the ureter. In fact, all of the filtration, absorption, excretion, all that occurs in the kidney, not in the ureter. And peristalsis, and this is the true answer. Wherever there is muscle, thick muscle, obviously there will be contraction. And if you remember from the digestive system, peristalsis occurs because of the muscularis externa. Similarly here, when urine forms in the kidneys, passes into the ureter and then gets into the urinary bladder. So the two ureters on either side, kidney here. The urine passes in the ureter and the ureter shows peristalsis, and so that the urine comes into the bladder by drop. So the bladder doesn't fill suddenly, it fills drop by drop. So this thick muscle wall is to allow for peristalsis, which is used for transport of urine. So therefore that is the right answer.